The Los Angeles County coroner is expected to release the results of Michael Jackson's autopsy sometime this week. Our Dr. Jennifer Ashton is here with the latest on what might be revealed. Good morning.
Good morning, Maggie. It's believed that at the time of his death, Michael Jackson may have been taking more than a dozen different drugs. With the release of the toxicology report, we'll finally know what role these drugs played in the King of Pop's death. Which drugs were in Michael Jackson's body when he died? How much? And did they cause his death? Those are just a few of the questions expected to be answered when the coroner's toxicology report is released.
My guess is we'll find multiple drugs. It's the synergistic effect of all of these drugs together that caused this respiratory problem.
Jackson was reportedly taking the painkillers Demerol and Vicodin, antidepressants Zoloft, Paxil, and Xanax, and the muscle relaxant Soma. The prime suspect among the drugs that may have contributed to his death is Diprivan, a powerful sedative used in hospitals to put patients under. Several bottles of the drug were found in Jackson's rented mansion.
It's complete madness that anyone would use this drug outside of a very controlled operating room or hospital setting. If you make a small error in how much you give yourself, even 1 cc's difference, you might go from being high to being dead.
And the drug's potency can be affected by other drugs. So if Jackson was also on painkillers and sedatives, the combination could have been fatal.
All he wanted was to sleep, but he was in trouble.
Jackson's former nurse claimed that the singer wanted Diprivan to treat his insomnia.
The fact that there's a possibility that this drug was being used for sleep is madness. It's like using a cannon to shoot a mouse.
The toxicology report may determine if charges will be brought against Dr. Conrad Murray or any of Jackson's physicians.
Diprivan is a smoking gun, and this very well may border on criminal activity.
Maggie, to safely administer Diprivan, you need sophisticated equipment to monitor breathing, blood pressure, and heart rate. That's why it should never be given in a home setting. It should only be administered by a trained anesthesiologist.
And should never be taken for insomnia.
Correct.
Thank you, doctor.